Hello, everybody. This is Dr. Gina Macros. I'm a retired chiropractor, but I've been a massage therapist for 36 years, and I've taught massage, medical massage, all over the country. And I want to share with you a couple things I think you need to know if you're about to get your first massage. Or maybe a friend just gave you a shoulder massage once and you want to go in and see a professional. Here's a couple of things you need to know. I'm going to be posting some other videos after this that you might want to watch as well, but this is just an introduction, but it's pertinent. And these are the absolute must-haves in a massage room. Most of these have to do with the laws. So let me start by saying that all of the states in the United States should have a massage license, but there are 5 that still do not in 2022. Might I say, that's a bit criminal in this day and age that anyone should be able to put their hands on the human body and have no training. Second of all, to not have a license when some of these issues that you're going to be dealing with have a medical background or people are on medications and we need to know about them. So I'm in Rochester, Minnesota. We don't have a license in Minnesota, but we have a city license, which really doesn't mean about anything in the sense that it doesn't stop prostitution from happening. It doesn't guarantee a certain level of training. And I think that's important, especially around Mayo Clinic, because we're dealing with people on medications and you can't put your hands on certain muscles or certain places if there's certain medications. So deep tissue work on the low back, if they're a kidney patient, is contraindicated. If someone's a diabetic taking insulin and we work at your insulin site too aggressively, you'll uptake your insulin too fast. And we need to know these things. So let's do that for another video when I get crabby about the laws, because then we can really wax profound about Minnesota. So let's start with the first thing. And I'm going to back here because this is a little teeny home office. And I have here a beautiful little bamboo screen. Lots of times there's a door. If you're in a hotel room, a hotel or a cruise ship or a professional medical office or a chiropractor's office, get in, there's going to be a door. I have a small home office and I have this beautiful screen and I'll say to the client, hi, come on into the treatment room. And here we are. It's a small room, but guess what? Massage therapists, you'll find all of our rooms are pretty small because we don't really need anything but our table and our oils. Some of us have bolsters, handheld thumping, thumpers, those little massage tools. But for the most part, sorry to move so fast. For the most part, they're very simple. A place for them to sit, maybe take their shoes. They're going to take their clothes off. Most people are going to have a hook of some sort. Obviously, the beautiful table. Your degrees or certifications should be well visible. Remember, if you're in a facility like a chiropractor's office or a spa, those may be at the front desk in a frame where you see them, and you can say to the facility, are your therapists licensed? Did they go to school? You can even ask them and be audacious enough to say, do they have any anatomy training? Because if you don't know what you're touching, do you really have a right to touch it? In the 70s and 80s, when we were all hippies in California, we weren't so regulated. But the thing is, we are right now for a reason. And I'm showing you this little picture because it's a simple table. My anatomy books, I show clients pictures of muscles all the time. My creams, my essential oils, the Kleenex, you don't need much more than that. I actually hide a lot of my oils. It's perfectly fine to have a whole open shelf of them and some products they may want you to use. And then, like I said, these are my college degrees. I have my certifications elsewhere, and there's bones. I was a chiropractor, but I like to show clients their bones. If I'm working on a rotator cuff, we pull out a shoulder, hip strain or migraine, TMJ. We have some bones. I can show them the muscle attachments. And then here's my Rochester City license, my national certification to be a continuing education provider because I teach anatomy, physiology, medical massage, advanced techniques, and the laws, the ethics and boundaries of sexual massage, how to make sure people are boundaries are very, very strong. And I say that because there's a lot of places where there's some iffy stuff going on. If I'm in Rochester, Minnesota, near the Mayo Clinic, and there's prostitution right downtown. So there's been some effort to stop it, but let's just say the word some. So the next thing is, when you come in the room, we give you some education, hopefully, and tell you what you're about to expect, and you'll take your clothes off and then put them back on at the beginning and the end of the session. But having said that, here's the deal. I start everybody face down. Some clients start you face up on this beautiful table. I don't know why. A little bit of a crazy technique, but I get it. The majority of people start you face down for a reason. We start at your feet, move up towards the head, moving blood always towards the heart. Those that don't and work down, it's a different kind of technique. We try to always work from your feet up, moving all the blood up towards your heart. But, so I'm going to turn around and show you what therapists must leave the room when you get, oh, sorry about the room, must leave the room when you get dressed and when you get undressed. It's an absolute must. There should never be a therapist in the room when a bra comes off, when underwear comes off. Sometimes when we're initially talking, a client might be taking their sweater off or sitting in the chair, taking their shoes and their watch, putting their cell phone on the bench. But you are never allowed to be in the room when genitals are showing. One, for their protection, and two, for yours. And yes, tons of us have been called to court. Not me, but have been called to court on questionable issues. I've been called to support clients. I've been called to support clinics. And I'm going to sit in the client chair and show you their perspective. So I want the privacy to get disrobed. I'm going to be talking to them from the other room sometimes, what's going on. I usually do that in the room, but sometimes if time or they're in a hurry, whatever. So I might be saying, okay, get on. Hey, what happened after our last session? I know you're working with the chiropractor, how'd it go? Whatever you're doing. And then when you come back room, the client is face down on this table with your head in this beautiful face cradle. For those of you who haven't seen one, we don't let you just torque your neck and turn it to the side. The whole beauty of massage and working on the the back of the neck is that most of you come in with head and neck strain. And this allows your head to be worked on without it being twisted. And then we come in, and I'm going to probably cover you even some more depending on the client. So having said that, there's a lot of people that are hot boxes. I'm one of them. I have to have my feet out. I like to have my legs out without being covered if it's too hot. But you should never, ever see an undraped or unblanketed butt. No butt cheeks. We'll talk about that in another session about how to draping techniques and are they doing it right. And for the therapist who wants to learn better techniques, I'll show that. But I should never walk in and see someone's butt or breasts. It's against the law. They need to be private. I want to be private. And for our sexual assault survivors and our victims of inappropriate touch, who are also our men with the clergy and other things, but let's not forget are very, very religious people who had those experiences in the Catholic Church. We provide a safe environment in massage. It's the only time you can get touched gently and really relaxingly without it being sexual. It's a beautiful, trusting experience. Nobody's genitals should ever be showing. I'm going to do that on another video. But suffice it to say, if you need your abdomen work, your breasts have to be covered. If you're a guy, I still cover them. Some guys don't care, but you are never, as a woman, allowed to say, yes, I give you consent. There's some places that will say, well, if you give me consent, I can drape you down to your waist so the breasts hang out and you're working someone's abdomen, maybe after a C-section or someone's doing too many crunchies or tradespeople who get abdominal strains. You can't do that and never look at a breast. That's all I'm going to say on a female. Even if you get an informed consent, I'll take the person to court. So, and I'm going to say that because it's happening. Okay, the next thing is you're face down. We turn when we're done with your back and your legs, we turn you face up. A lot of us put a little eye pillow on your eyes to protect you from the light. Although, might I say, we work in a dark room. This was just for the video. I work in a completely dark room. I never talk when the client's on the table. Sorry. If you get a person that does a lot of chatting, I'm not a big fan. So I'm going to walk back to the entryway. And let's say we're done and I come back in, you get dressed, we deal with it. I'm going to take a payment, usually at that time. Some of you are lucky enough to take prepayments. I don't find it necessary in a small place like this. So having said that, that's your first massage. Entryway security. We knock when we come back in. We might say crack the door before you get on the table, but when we come back in that room, you're on the table. Your clothes should always have a nice place to go, a hook or a chair. There should always be a visible level of certification or licensing visible. If and when, I'm hoping that there's water nearby. Here's my sink so I can go in here and wash my hands before and afterwards. You should hear the therapist wash their hands afterwards. They're going to leave the room maybe if they're in a hotel or whatever and come back in. They already went and washed their hands. So anyways, those are a couple things to think about. I'm new at this. I would love a like If you don't like it, don't do a thumbs down. Just tell me what you don't like and it'll help me get better. And then, you guys, would you mind subscribing? It would really mean a lot to me as I begin and foray into these educational videos. I've been educating for a long time, and I'm going to start doing videos. Appreciate your time.